Kawasaki disease is a rare but serious condition that causes inflammation in the blood vessels throughout the body. It most commonly affects children under the age of 5, though it can occur in older children too. The condition was first described in 1967 by Dr. Tomisaku Kawasaki in Japan, and that's how it got its name. What makes this disease particularly important is that it can affect the coronary arteries, which are the blood vessels that supply blood to the heart muscle. Think of your blood vessels as pipes that carry blood throughout your body. In Kawasaki disease, these pipes become inflamed and swollen, which can lead to complications if not treated properly. It's like when a pipe gets narrowed, the water, or in this case, blood, has trouble flowing through smoothly. If left untreated, Kawasaki disease can lead to complications such as aneurysms, which are weakened and bulging areas in the artery walls. These complications can increase the risk of heart problems, including heart attacks and long-term damage to the cardiovascular system. The good news here is that despite its potential severity, most children recover fully with timely medical intervention. Types of Kawasaki disease. There are two main types of Kawasaki disease that doctors recognize. Number 1. Classic Kawasaki disease. Classic Kawasaki disease occurs when a child shows the typical signs and symptoms that doctors look for to make a diagnosis. These symptoms need to be present for at least 5 days to be considered classic Kawasaki disease. Number 2. Incomplete or atypical Kawasaki disease. This type happens when a child doesn't show all the classic symptoms, but still has the condition. This type can be trickier to diagnose because it doesn't follow the typical pattern, kind of like solving a puzzle with some pieces missing. Causes of Kawasaki disease. Here's the interesting thing about Kawasaki disease. Doctors and researchers still aren't entirely sure what causes it. However, they have some strong theories. It's believed that the condition results from the body's immune system overreacting to something like an infection or an environmental trigger. There's evidence suggesting that certain infections, both viral and bacterial, might trigger the condition. This explains why Kawasaki disease is more common during winter and spring when these infections are more prevalent. Think of it as your body's defense system going into overdrive and accidentally causing damage in the process. Genetics may also contribute to Kawasaki disease, as children of Asian descent, particularly those of Japanese or Korean ancestry, have a higher risk of developing the condition. Family history can also be a factor, as siblings of affected children are more likely to develop the disease. However, it should be noted here that the condition does not appear to be contagious, meaning it does not spread from person to person like the flu or other infectious diseases. Symptoms of Kawasaki disease. The symptoms of Kawasaki disease typically develop in phases. Let me walk you through how it usually unfolds. In the first phase, acute phase, which usually lasts 1 to 2 weeks, your child might experience a high fever that persists for 5 days or more. Along with the fever, you might notice your child's eyes becoming red without any discharge. This redness affects both eyes and might make them look irritated, similar to pink eye, but without the gooey discharge. The mouth and throat also show changes. The lips often become red, dry, and cracked. The tongue might develop a strawberry-like appearance, becoming bright red with little bumps. The inside of the mouth and throat may also become red. A distinctive rash typically appears on the body. It can look different from child to child, but it often appears as red patches or spots. The rash might be more noticeable in the groin area and can spread to other parts of the body. The hands and feet often become swollen and red. Later in the illness, the skin on the fingers and toes might start to peel, similar to what happens after a sunburn. Lymph nodes in the neck often become swollen. You might notice a large tender lump on one side of your child's neck. During the second phase, or subacute phase, which occurs around weeks 2 to 4, symptoms start to improve, but this is actually when complications can develop, especially in the heart. Diagnosis of Kawasaki disease. Diagnosing Kawasaki disease can be challenging because there's no single test that can confirm it. Instead, doctors look at the combination of signs and symptoms, along with several laboratory tests. The diagnostic process typically involves a thorough physical examination where the doctor looks for the classic signs of the disease. They'll also take a detailed medical history to understand how the symptoms developed. Blood tests are usually ordered to look for signs of inflammation. These might include tests for C-reactive protein and erythrocyte sedimentation rate, which are typically elevated in Kawasaki disease. An echocardiogram, or heart ultrasound, is crucial in the diagnosis process. This test helps doctors see if there's any damage to the coronary arteries or other parts of the heart. It's like getting a detailed picture of how the heart is functioning. Other tests might include chest x-rays, electrocardiograms, and additional blood tests to rule out other conditions that might cause similar symptoms. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment for Kawasaki disease. The treatment of Kawasaki disease needs to start as soon as possible to prevent complications, especially heart problems. Here are the main treatments available. Number 1. Intravenous immunoglobulin. This is the primary treatment for Kawasaki disease. Intravenous immunoglobulin is given through an IV line and contains antibodies collected from healthy donors. It works by helping to reduce inflammation in the blood vessels. The treatment is typically given as a single infusion over several hours. Most children start feeling better within 24 to 48 hours after receiving IVIG. It's crucial to give this treatment within the first 10 days of illness for the best results. If a child doesn't respond well to the first dose, they might need a second dose. Number 2. Aspirin therapy. Aspirin plays a dual role in treating Kawasaki disease. Initially, high doses are given to reduce inflammation and fever. Once the fever goes away, the dose is lowered, and aspirin is continued for several weeks to prevent blood clots from forming in the coronary arteries. It's worth noting that while aspirin isn't normally given to children due to the risk of Ray's syndrome, it's considered safe and necessary in treating Kawasaki disease under medical supervision. Number 3. Additional medications. For children who don't respond well to IVIG, doctors might prescribe other medications. These could include steroids like methylprednisolone, which helps reduce inflammation more aggressively. In some cases, medications called TNF inhibitors might be used. These work by blocking specific proteins in the body that cause inflammation. Number 4. Coronary artery treatment. If a child develops complications involving the coronary arteries, additional treatments might be necessary. These could include long-term anticoagulation medications to prevent blood clots, and in severe cases, surgical procedures might be required to repair damaged blood vessels. Number 5. Supportive care. This includes managing fever and pain with appropriate medications, ensuring proper hydration, and providing adequate rest. The child might need to stay in the hospital during the acute phase of the illness for close monitoring. Most children who receive prompt treatment for Kawasaki disease recover fully within a few weeks. However, regular follow-up care is essential, especially in the first few months after treatment. This includes regular heart checkups with echocardiograms to monitor for any changes in the coronary arteries. The frequency of these checkups will depend on whether there was any heart involvement during the illness. Some children might need to continue taking aspirin or other medications for an extended period, depending on their specific situation. At the end, remember, while Kawasaki disease can be scary for parents and children alike, with proper medical care and support, most children recover completely and go on to live normal, healthy lives. Now, we want to hear from you. Have you or someone you know experienced Kawasaki disease? What was the journey like, and how was it diagnosed and treated? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.